My arm is weak. I can't hold it up.
So they said I had a stroke, and then they left. What happens next?
Hello, I'm Dr. Louis Morgenstern, Director of the Stroke Program. I'm sure that you and your family are wondering what the next few days will be like and how long you'll be at University Hospital. We hope this video will provide useful information to you on how we care for stroke patients at the University of Michigan. We have a great team of doctors, nurses, and therapists who have spent years of training to care for you at this important time in your life. We know that this can be a scary time. We hope to make this as easy as possible.
I wish they'd come back. I still have some questions.
It looks like they have some really sick people here.
I'm Dr. Saucer, the emergency department attending in charge of your care here. When you first came in, we asked you questions and examined you to quickly determine the diagnosis. As the team told you before, you had a stroke. Most strokes occur when a blood vessel is blocked, and blood cannot get to a part of the brain. That small part of the brain dies. Some strokes occur when a blood vessel ruptures. We have special treatment for stroke that we can use when patients come early enough. And that is why we usually surround you quickly to determine if you can get that treatment. After that, we wait for test results, and we ask the stroke team to come see you and evaluate you.
Oh, okay. Makes sense.
He thought you forgot about him.
No, I didn't.
Even though I'm not always at your bedside, we're always taking care of you, and the nurse is constantly monitoring your condition and updating me.
See? I hope you get to eat lunch too.
Yes, thank you. In the emergency department, we usually get a CT scan, and we get blood tests, and we ask the stroke team to come see you and evaluate you.
Hi, I'm Dr. Morgenstern. I'm the attending physician from the stroke team that will be taking care of you upstairs. I've reviewed what's happened down here, and now it's time for me to get to know you and your family a bit better. I'd also like to hear a little bit more about the symptoms that brought you to the emergency department today.
Well, when do we go upstairs?
Sometimes it can take quite a while to free up a bed in the stroke unit, but the stroke team starts taking care of you right down here in the emergency department.
Thank you.
Hi, I'm Kate Maddox, nurse practitioner with the stroke team. Most of our patients are taken care of in the stroke unit on the 4th floor of the hospital. The stroke staff is specially trained, and we meet daily to discuss your care. Some patients are taken care of on other units, but no matter where you are, you'll receive excellent care.
Kind of like a 4-star hotel?
Well, more like 4-star stroke care.
Most stroke patients get an MRI scan or another CT scan after admission. MRIs make a lot of noise, and you need to hold very still for us to get good images. See? It's really open. Some people feel claustrophobic, but no one has ever been stuck in an MRI scanner.
I'll just think about puppies instead of this machine.
One of the most important parts of your stay is trying to find out why you had a stroke so we can work with you to prevent it from happening again.
Well, please do.
The CT and MRI scans are a big part of that. Sometimes the heart can be a source of clots that break off and travel to the brain. So we will examine your heart. We'll monitor your heart in the stroke unit, and we'll get an echocardiogram.
I'm Dr. Bach, a cardiologist. We do 2 types of echoes. One of them is a transthoracic echo, or a TTE. With that procedure, we use an ultrasound machine to take pictures of your heart through the surface of your chest. The other is a transesophageal echo, or TEE. With that procedure, we use the ultrasound to take pictures of your heart from the esophagus or the food tube after you swallow the probe.
More thinking about puppies.
Puppies?
Never mind. Just the tube down the throat sounds unpleasant.
It's not that bad. We use a spray to numb the back of your throat and give you a medicine to make you sleepy, and you don't really feel the procedure. Maybe a little bit of a sore throat when it's all done.
Well, can I get some ice cream maybe for the sore throat?
Sure, as long as it's low fat.
We want to get you better and minimize the symptoms of your stroke.
I'm gonna need a cigarette. Where's the smoker's lounge?
We'll be talking about your risk factors for stroke, like smoking, for example, and helping you minimize your risk. Stroke is very preventable.
Do family play a role in this education?
Oftentimes, family is key to helping patients reduce their stroke risk.
Oh, can't wait.
We put together a fantastic team of professionals with the training, experience, and motivation to take care of you. You've met a few already. I'd like to introduce you to a few more.
Hi, I'm Hendrika. I'm a physical therapist. I'll be helping you if we find you need to improve your walking or your balance.
Hi, I'm Caitlin, and I'm an occupational therapist. I'll be working with you to improve your hand and arm function.
Hi, I'm Karen. I'm a speech-language pathologist, and I'll be evaluating your speech and language, and the nurses and I will be assessing your swallow function.
It was nice to meet you all. I like having an entire team taking care of me.
Well, don't get too used to it.
I mentioned that I'm the attending physician. We are faculty members leading the team caring for patients and teaching. We will likely have residents, interns, and medical students also involved in your care. They are at different stages of their training, and while they're here to learn, they are also here to take care of you, and they do it exceptionally well. It is just one of the reasons why the University of Michigan provides such a high level of medical care.
I can see he'll get great care. We may spar a bit after all these years together, but my husband means everything to me. But what if he needs something at, say, 3 a.m.?
We are here for you. There are always doctors and nurses around to answer your questions. We regularly make rounds to review what has happened and work with you to decide what the next step should be. Please ask us questions. The person to start with is your nurse. Please let her know if you are not feeling well or have any concerns.
Thank you. Let's get started.